Dr. Jason Shrouder-Henry. I'm a board-certified orthopedic surgeon with a subspecialty in hand, wrist, elbow, and shoulder surgery. I decided to pursue orthopedic surgery as a second-year medical student. I enjoyed the anatomy immensely, as well as the patient population, having the opportunity to work with laborers as a hand surgeon specifically. And I also enjoyed the hands-on, task-oriented approach to orthopedics. So orthopedic surgeon salary in Illinois is around $500,000 with a range above and below that depending on your specific practice setting. Mentorship has been critical to my success throughout my journey. Really starting in high school when I had a high school mentor who was my physics teacher, a black male, who really provided an excellent example of hard work and how to be a good, well-balanced family man. And then moving from there, going on to college, I had great support from actually black medical students who were ahead of me, who were in medical school, but they quote unquote reached back to help and support me as I applied to medical school and were critical in allowing me to actually get into medical school. And then moving on to medical school, the community of other students of color there, as well as academic advisory deans, were crucial in allowing me to succeed and perform in a way that allowed me to get into an orthopedic surgery residency. And once I settled into the University of Toronto, there were mentors across a variety of subspecialties. I decided to hone in on hand surgery and found a supportive network of surgeons there who were able to help me match into hand surgery in San Antonio, Texas. And then from there, a supportive network of mentors again, specifically hand surgeons that I speak to weekly until now. And they've been crucial in allowing me to navigate the practice world once you're actually finished your training. The person likely to succeed in my field is hardworking, high academic level of performance. A person who's self-critical, who's able to reflect and striving to continue to improve. Approximately 1.5% of orthopedic surgeons in the US are black. Yes, I do think we need better representation in orthopedics. You know, the community of African American and black surgeons that exist in the US is very tight-knit, and we are all basically in constant communication with each other. And our goal is to grow that number of orthopedic surgeons. So there's different surgeons in different academic settings that are continuing to strive to kind of push and grow the volume of black medical students that are getting into orthopedics, that want to go into orthopedics specifically. My typical workday starts at 7 a.m. Preparing for surgery or clinics for that day. I then have clinic at 8 o'clock to 12 o'clock typically, and then I proceed with operating in the afternoon from 1 to 5 o'clock or 6 o'clock. And that all can vary. Sometimes you have emergencies that come in and you gotta go in the middle of the night, or you have to go in 6 a.m. in the morning, or you have to stay late at the hospital. So it's a fluid schedule, but on average, that's what my day looks like. I would recommend, if you're interested in pursuing orthopedics, get out there, meet, talk to people who are orthopedic surgery residents or who are orthopedic surgeons to see what the path and journey looks like. I think if you're something you really want to do, you need to be hardworking, you need to take your studies extremely seriously. High academic performance is going to be the main barrier to entry in terms of becoming an orthopedic surgeon. And you have to primarily be self-reflective. It's the thing that is probably the most important, in my opinion, in terms of my skill set, in terms of why I've been able to succeed and improve from one surgery to the next, improve from 1 year to the next. It's being highly critical of your own work and having a lot of pride in your own work. One of the major challenges I faced was when I returned to Canada for my orthopedic surgery residency at the University of Toronto. Transitioning from Georgetown, we had a very close-knit group of medical students, moving back to Toronto, where University of Toronto is a very large program, and it took me a little while to get my footing and find out who my mentors were going to be, who were going to help me to succeed. But I was able to, through perseverance and kind of networking, connect with a group of mentors, orthopedic surgeons, hand surgeons in Toronto, who were critical in allowing me to pursue my dreams of becoming a hand surgeon. Yeah, I think platforms like Gibraltar Medical are very important, primarily because we need to raise awareness of opportunities for mentorship. There's plenty of orthopedic surgeons that are minorities who just aren't aware of these opportunities to help younger students progress and give them advice. And on the other side, there's plenty of students who aren't aware of these platforms, thus aren't using them to get advice, to get further mentorship. The one thing that separates our colleagues who are not minorities from us is that they often have a kind of preset pathway of advice, of mentorship that they can follow and they know will lead them to success. So as minorities, specifically as Black males and females, we need to make that pathway to success so that the students who are just as capable, just as smart, can follow it and achieve their goals just like any other group.